Hello, I'm Aniello Iannuzzi, the Chair of the Australian Doctors Federation. On Saturday the 3rd of May, which happened to also be the day of the federal election, AMPS and the Australian Doctors Federation co-hosted a one-day meeting or conference on the misdeeds of AHPRA. Even though it was election day, we had about 200 present, not only medical practitioners, but also other clinicians who are working under the supervision or management of AHPRA. What we heard on that day was a very serious list of problems that AHPRA has created over its 15 years of existence. So July this year marks the 15-year anniversary of AHPRA for those of you who are so used to AHPRA, but it is still a relatively new concept. Anyway, we heard stories about how patients are being let down, how doctors are being let down, how AHPRA at times shows features of incompetence and sometimes possibly even of corruption. The themes can be basically divided into three main categories. One category, and the main one, is lack of procedural fairness for those being investigated, and arguably also for patients. AHPRA really needs to have some time limits set on the length of time of its investigations. Patients and doctors and other clinicians who are subject to AHPRA investigations can have their matters drag on for months and months, for years and years. And when there is closure, oftentimes inadequate explanations are given. I think we need to think seriously about having time limits on all investigations. And when investigations are found to be to do with matters that are dismissed, we need to think seriously about whether the clinicians who are accused of things should be entitled to compensation. Also, if there's serious misconduct on the part of the investigators, there need to be punishments put in place for the staff of AHPRA who have mismanaged the investigations. The other thing that came out of the procedural fairness issue is anonymous complaints. Anonymous complaints can lead to a lot of heartache, financial ruin, and even suicide for some clinicians who are investigated. Is it time for anonymous complaints to be banned? Another thing that was raised that's of great interest is whether people who complain should be paying a fee in order to support their complaint and to prove that their complaint is genuine. This is something that happens in other professions when it comes to complaints, and something that perhaps we need to think about, particularly if a complaint is anonymous. So that's one area. The other area of great concern is oversight. AHPRA, as it stands, is an organisation that is neither state nor federal. It's a bit of everything, really. And as a result, there's no clear line of command with ministerial oversight. We talked about the issue of reverting back to state boards. That seems to be what most people think would be the best solution, but another solution would be to put it under the ministerial oversight of the Federal Health Minister. But as it stands now, it's too easy for people who complain or have issues against AHPRA to be launched into a process that really doesn't have a chain of command, and it's too easy for senior bureaucrats and ministers just to pass the buck and not to take responsibility. It makes you ask whether AHPRA is actually protecting ministers and senior bureaucrats rather than the patients that they're meant to be protecting at AHPRA. And the last thing is financial. AHPRA's fees are really out of control. They're well above CPI. They're certainly well above the way Medicare's been indexed. And at least for doctors, we've got to ask ourselves, we're paying about $1,000 a year, in some states even more than that. Why are we paying that much money, and where's the money going? I think it's time to think seriously about lobbying for the AHPRA mechanism to be funded by the government itself rather than funded by the clinicians, and that will make government more interested in making AHPRA more efficient and more fair, and also will lead to more accountability on the part of AHPRA. So they're the three main themes. There are certainly plenty of other things that came out of the conference, and over the next few weeks we'll be releasing video and other footage from the conference, some AI presentations as well. There'll be all sorts of things coming out on our website and social media to do with the conference. With a very clear mandate given to the new federal government, it's a great opportunity for all the professions under AHPRA to lobby the minister and the state ministers for AHPRA reform and more AHPRA accountability and a fairer go when it comes to our AHPRA fees. So That's a brief summary of what happened last Saturday at our Misdeeds of AHPRA conference. Keep an eye on our social media and on our website for more information.